Speaker is the chair of this postgraduate course, Dr. Liane Feldman, who has been there from day one, and will talk to us about how do we build the certification aspect of FUSE. And Liane, thank you very much.
Thank you. So we're almost there, 4 hours later. And I really appreciate the attendance. And this has been a great experience for me and for Pascal to work on this program. And I'm going to explain to you, I hope, how you can be involved in the really important process of making this into a real SAGES fundamentals program. So the postgraduate course that you've just attended is part of a program to teach surgeons, primarily, how to safely use these devices that we use every single day. And as part of that process, this includes a curriculum, and it includes a validated examination, as do the other fundamentals programs. And that would lead to certification in FUSE certification. The program, the curriculum has 10 domains, and you've basically just received the curriculum. And these were the 10 domains that basically we discussed today. We discussed fundamentals of electrosurgery. We've especially tried to focus on safety. You can see that of these 10 domains, we have 63 learning objectives for the program, and a third of them have to do with safety. It's supposed to be very practical and patient-oriented. We discussed monopolar devices, bipolar devices, ultrasonic, radio frequency ablation, and you can see these things are much less highly weighted in terms of our overall goals of the program. A pediatric consideration and integration with other medical devices. And this has gone through a process to determine how to prioritize these different objectives. So as an example, just quickly, if we look at the fundamentals of electrosurgery domain, we had 7 objectives: defining terms, applying Ohm's law in terms of when you turn up the power, what are you doing? You're turning up the voltage, functions of the generator, the waveform, etc. That was the first talk, and these were the objectives that we had for that domain. How we want to deliver the curriculum, there are 3 ways that we'd like to deliver the curriculum. One way is the way we just did, which is through this postgraduate course. And this is the 2nd year that we've done this course, and we're certainly continuing to refine it, and your comments are very helpful, and I've written them all down in terms of things that you think should be prioritized or emphasized and things that didn't come through clearly. These are really helpful. The second way that we can deliver the material is through a book, that the SAGES manual on FUSE, fundamental use of surgical energy. The syllabus that you can download from the website from this meeting is that manual in electronic form, or you could buy it. It's a book. And that also basically has the entire curriculum in book form. And thirdly, we are developing a online, a little bit more of a multimedia curriculum like FLS or FES that basically takes the book and puts it into this format. And that is in development, and hopefully by the next few months we'll have that ready to go. So those are the 3 ways where the program will deliver the curriculum. Now, what is the purpose of having an exam? Why have an exam? And I think that's a legitimate question. And the reason to have an exam is to actually have this part, the certification, to certify that the successful candidate has the knowledge fundamental to the safe use of surgical energy-based devices in the operating room, endoscopic, and other procedural areas. So it's the way to say that the successful candidate on this exam can be certified that they have this knowledge. That's the point of having the exam. It's another level. And this is really the philosophy of all the SAGES fundamentals programs, to have expert content curriculum and validated testing. So that's very important, that big word, validated testing to verify learning and have certification. So creating a valid exam is, and I'm almost done, I don't have to belabor this point because I'm getting to what I'm here to request of you. So creating a valid exam has not been something that we've just taken out of the air. There are actually people called psychometricians, and this is what they do. And we have been the subject matter experts, but working with a consultant in this very long process to go through this correctly to create a validated exam that can stand up to scrutiny. And to do that, we have a couple of beta tests that we need to use to see how good the items are on the beta test in terms of making a validated exam. So right now, the final test will have about 75 questions. Right now, we have a beta test that has about 160 questions. There are two versions of the beta test. And we need to get data on that to know which questions are too easy, which are too hard, and which are just right. Now, the good news is that beta testing is available at the SAGES meeting for the FUSE exam in this week in the FLS Test Room, which is on the mezzanine level, one floor down. This is a multiple choice exam given by a computer, and it's not easy. It's 160 questions, and it takes about 90 minutes. So basically, we need you. We need your help. Because we need to know that we're able to deliver the curriculum to you or to other people like you and like me and like Pascal to contribute to a safer operating room environment. We want to know, because before I was involved in this, I would not have passed this exam. And a lot of you are here because you feel that probably you don't have the information that you need to contribute to this safer environment. So we need to know if this delivery system is sufficient to have people be able to pass this exam. And I think that's really different than what we had for FLS or FES, where we know that there are experts in laparoscopic surgery, or even people that use it every day. We could use them to understand where the passing level should be for the exam. But most of us don't consider ourselves experts in this area, even if we use these stuff all the time. So it's really important to find out that we can deliver the content to you in this way. So why do this? Why take the 90 minutes? Because, you know, maybe it's the right thing to do to help SAGES continue to lead in the creation of these validated educational materials, and that's something that really sets us apart. And I think that that's really something to be very proud of. And of course, to assess your own knowledge and to see where you stand in relation to this knowledge. And I think that that's the most important reason to do it, because that's the internal motivation, and that's really why we do what we do, most of what we do. Some people think that people need external motivators. I don't know. I'm not sure that we need so much external motivators, but you know, we will, you know, we do want to be grateful in a concrete way for you deciding to spend some of your time that way. So you will get a complimentary test voucher for the FUSE program, including the online curriculum, and for the final exam once the validation process is complete. And of course, if you think that way, you will get a head start on the content of the exam, because these questions will be on the exam, not all of them, but you will see the exam as it will eventually be. And you'll get a mug, and you get a pin, which we have. These are hard to get. And you get our undying admiration and gratitude, which you probably already have. But you get a pin. It looks like this. With that, I'd like to, we have a few minutes for questions, and there were some questions that were texted and tweeted. So if we could have the speakers, the last session, come up. We have about 10 minutes for your questions, if you'd like, and then we will adjourn.